Let us introduce the wonderful panelists that we have with us today. It's our pleasure to welcome Lana Voracek, originally from the traditional territory of the Adirondack and Haudenosaunee peoples in Ontario. She completed her Bachelor of Science in Nursing at Toronto Metropolitan University and worked as a registered nurse caring for ill and preterm infants in a neonatal intensive care unit in the Greater Toronto Area before starting her Master's of Public Health at UBC. Her passion for climate change is a health issue, and her concern for the futures of her patients is what drew her to the field of public health. Throughout her 2 years of graduate studies, Lana has engaged with climate work in many ways, including working as a teaching assistant for the Health Impacts of Climate Change course in the UBC School of Nursing and starting a podcast called Pulse of Change, which will be launching soon. Lana is grateful to live, work, and play on the traditional, unceded, and ancestral territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. We have also with us today Nafis Rahman. Rahman is a master's student in the public health program at the School of Population and Public Health in the Faculty of Medicine, UBC. Her academic journey began with a Bachelor of Medicine and Surgery from Faridpur Medical College, Bangladesh, followed by a master's in public health with a major in epidemiology from the American International University, Bangladesh. Her career has been enriched with diverse experiences, including roles at renowned organizations like the Johns Hopkins Program for International Education in Gynecology and Obstetrics and the Institute of Epidemiology, Disease Control and Research, Bangladesh. Her pursuit of a second Master's of Public Health is driven by a profound commitment to address the global impact of climate change on health. She has had the opportunity to work on the Nutrition in City Ecosystem Project, where she's visited the rural areas of Kenya and Bangladesh and witnessed firsthand how climate change is affecting their food production system, which has further deepened her understanding of the pressing challenges in public health. Welcome.
Thank you so much, Rob. So before we dive into our session, we'll quickly lay out the format for today. We're going to ask each of our two lovely panelists to take about 5 to 10 minutes to share their viewpoints about the topic of climate change and interinstitutional dialogue within the field of public health, after which we'll open the floor for a general discussion and answer any questions that you might have for our panelists about the topic. But keep in mind that you're very welcome and encouraged to post any comments or questions in the chat at any time throughout this session, and we'll be sure to keep an eye on it. So with that, we'll stop sharing our screen and I will pass it over to Rob to kickstart our conversation.
Great. Lana, we'd like to invite you to introduce yourself and your experiences and perspectives on climate change and public health.
Sorry, Lana, I don't mean to interrupt you at all. It's just, I don't know if it's just my audio or if it's everyone's, but it's just a bit choppy. Is anyone else experiencing that? Yeah. Maybe it's just a poor connection. I just wanted to let you know.
Sorry.
No, take your time. That's okay. It's still an issue. Does it make sense to jump to Nafis and then we'll give you some time to troubleshoot for a minute? No rush. I think we're still unable to hear you. Okay, sounds good. Perfect. Okay. So maybe in the meantime, while Lana is troubleshooting, we can jump to Nafis if that's okay to go ahead and maybe share some information about yourself and your perspectives on climate change.
Sure, Jamili. Thank you so much for having me here. Hello, everyone. I would like to start with my land acknowledgement first. I feel grateful that I am studying at the UBC School of Population and Public Health, which is situated on the traditional, ancestral, unceded territory of the Musqueam people. I am studying here as a guest, as an international student, and I am really grateful for that. Let me introduce myself. I did a bachelor in medicine and surgery from Faridpur Medical College Hospital, which is a tertiary level medical college hospital in Bangladesh. And I did 1 year clinical internship there. After finishing my medical study, I selected to choose a public health career instead of a clinical career because I was always interested to serve the mass people instead of just giving them personal treatment. So for this reason, I joined Institute of Epidemiology, Disease Control and Research, IDCR Bangladesh, where I worked as a clinical research associate in the surveillance for emerging zoonotic disease threats and behavioral risk communication in the high-risk communities in Bangladesh. So I used to work closely with the high-risk communities who are mostly affected due to the climate change crisis in Bangladesh, and I have seen that how people were suffering due to the impact of climate change. And as I worked on the infectious disease sector, I worked on the dengue surveillance as well. And you might have known that last year, more than 10,000 people died due to dengue. So dengue has become a major issue in Bangladesh. So this experience in infectious disease sector actually made me passionate to gain more knowledge on the environmental health sector and public health sector. So for this reason, I did another master's from American International University, where I conducted a thesis research on antibiotic usage pattern and health-seeking behavior in the urban slum community in Dhaka. I worked in the largest slum, which is called as Coral Slum in Dhaka. And due to my research experience on that slum area, I have seen that how the slum dwellers are disproportionately affected due to the climate change crisis. And I have seen that how social equity, public health, and the climate change crisis are interplaying there on their lives. So this experience really made me passionate about for working on the climate change sector. Apart from this, I got the opportunity to work as I work as an advisory board member in the Nutrition in City Ecosystem project of the Swiss Development Corporation and the Syngenta Foundation for Sustainable Agriculture, where I'm still working there as an advisory board member, and I visited Kenya and Bangladesh in several field sites, and I have seen there how the agricultural sector is impacted by the climate change. And this project is actually making the vulnerable communities prepared for the impact of climate change and building climate change resilience in terms of food and nutrition sector. So this experience also made me become more passionate about to pursue my future academic career and professional goal in the environmental health sector. As I have a medical background and I'm interested in pursuing public health, so I thought that maybe it's time to pursue another master's or higher study abroad. So I chose UBC, School of Population of Public Health, as my graduate study institution. And the most interesting fact about SPPH was that SPPH focuses on social equity. And when choosing my courses and my institution, I saw that they offer several courses on the environmental health, which are relevant to climate change. So for this reason, now I'm pursuing my master's in public health in SPPH. So all these experiences actually inspired me to pursue a career in climate change. And I would like to mention that the climate change crisis is particularly impacting the low and middle income countries, the developing countries. And even in Canada, I have seen that the indigenous people are disproportionately affected by the impacts of climate change. So I think it's a major issue, it's a rising concern, and we should focus on this topic of climate change, which we should discuss more about climate change. So I am really feeling privileged today to be a part of this panel discussion, and really thank you so much for having me.
Thank you very much, Nafis. That's great. Now we're going to turn to Lana to see if we've got good sound and to get an introduction. Lana, please.
Hi, is it working better now? Okay, I'm so sorry for that. And yeah, first of all, I just want to say as well, thank you so much for having me on today, and I feel very privileged to be here. So I do have like 8 years of work experience as a neonatal intensive care registered nurse. I've worked in hospitals in the Greater Toronto area, and I also work here in Vancouver. And I think my experience caring for ill and preterm infants just like, yeah, I want to acknowledge that, like, for me, I come from like the most densely populated part of Canada, like Southern Ontario, and that area, like Canada is a very high income country. And also that part of Ontario, I feel like we have been fairly sheltered from the impacts of climate change until more recently. So, I'm grateful to be here to be able to speak on these issues, and I feel very privileged, and I want to acknowledge that there are people who are much more impacted than me that don't get to share their viewpoints. So I'm glad to be able to, and I'm fortunate that a lot of the learning that I've done about climate change and health has come from my own ability to seek out academic, educational opportunities and to do self-learning, which not everybody gets to do. So the reason why I have sought out those opportunities is because when I think about climate change and the babies that I care for, I think about their long-term futures, and I feel concerned about what is waiting for them when they're discharged from the hospital, when they grow up to be adults, and the future that they have. And so that's kind of where I'm coming from as being very passionate about this. And I also feel a little bit like it's an extension of my duty of care as a nurse to my patients to really uncover and understand the health impacts of climate change and take action against them. And I think my view on all of this is that I think it's so important to find ways to like really communicate this to the public and break down disciplinary silos and collaborate and work together to solve these problems like climate change, which is a wicked problem. Like it's a very, very tangled web of complex causes. And so we need equally wicked or complex solutions to solve it. So that's kind of how I view the problem and the actions that we need to take.
Oh, thank you very much, Anna. And I think what we're going to do now is to have a couple of questions by Jamalee and myself just to get things going. Jamalee, would you like to ask the first question?
Sure. Yeah, I'd be like, yeah, delighted to. And in the meantime, I encourage everyone again to either pop in or toss your questions or comments in the chat. We really hope for this to be a wider discussion. And we appreciate all of you for being with us today. So I've listened to the podcast multiple times, and I just want to say thank you both so much. I learned plenty and things I hadn't really thought about in terms of the connections between public health and sustainability. I have so many questions, and I don't really know where to start. But maybe I'll just start broadly and hope that that might kind of trickle into some of the other questions that I have. But in the podcast episode, both of you spoke about how the climate crisis is really altering the role of public health as an institution, but also specifically for public health workers. And I'm wondering if you could both speak a little bit more about maybe the immediate, but also longer term impacts of the continued climate crises on the role of public health workers specifically. I know that's quite a broad question, but I know that you were speaking about some of the changes being kind of top down and happening a little bit later on, but also like the inaction changes that you're seeing on the floor. So I'm curious to learn a little bit more about that from both of your unique perspectives.
Nafis, do you want to go first, or do you want me to go first?
I think, Lana, you go first as you have the Canadian experience. Yeah.
Okay. So yeah, I mean, I think I view climate change more so than changing the role of public health. I think it's just kind of like unveiling a need to transform public health and the other systems that we have in place to really kind of address the climate crisis. Like I think for me, again, linking back to what I said before, I think a lot about like silos. In some ways, I feel like professional silos is a lot of how we got into this problem because, for example, like I was just writing a paper about Lyme disease, and it's so complicated. Like there's a very complicated interaction between like the ecosystem and the like tick vector that transmits Lyme disease and also the actual infectious agent. And that relationship is so is even more complicated by different animal hosts and the climate. And so I think that there's so many different areas of expertise when it comes to like zoology and entomology and ecology that are actually very related to public health. And I think, yeah, I feel like there's a huge need to collaborate more across silos and sectors. So that's what I think of the most. And then I think as well, it's just that we in public health and the health system need to recognize that we need to look at climate change as something that is intersectional. So it's going to it's a context that we're all living within that's going to affect everything that we're all kind of doing. I think like the World Health Organization puts it quite well in saying that climate change is a risk multiplier. So it's like it's not a standalone thing, but it's going to it's going to amplify all of the other existing problems that we have.
Nafis, do you want to take it?
Yes. I totally agree with Lana. As Lana, you were speaking about Lyme disease. I would like to share my experience of dengue as well. Dengue is also a vector-borne disease like Lyme disease. So when dengue outbreak occurred on Bangladesh on last year, the health system was really devastated because we were not prepared enough. Many patients didn't get admission to the hospitals of Bangladesh, and really they had to suffer without treatment, which was really scary. So this is one thing in which the public health sector can work and collaborate in preparedness for the climate change related diseases. Like maybe for COVID-19, there are a lot of projects are ongoing for pandemic preparedness, right? So for climate change related diseases, there should be more programs and projects should be ongoing, and there could be collaboration with the environmental health and environment department as well, because when we have to prevent the climate change crisis, the environment should be improved as well. So yes, there should be a transformational change in the public health for mitigating the problem of climate change crisis. Only the public health sector alone cannot work to address this problem. So yes, we need collaborative solutions to manage this issue.
And I think also just like to build on what you said and the idea of transformational change. I think and also going back to the question about how is climate change impacting the role of public health workers? I guess also as a nurse, I'm seeing like clinicians organize on a grassroots level to try to bring more sustainability into their work, which I think is really amazing. It's also being done off the side of people's desks in most cases. But I think that also shows that there is transformation that is slowly happening and also needs to happen more. And also I think in like the acute care sector, there's sometimes the idea of sustainability is a competing priority with other things, but maybe I think sometimes we need to like shift our paradigm a little bit from thinking about the individual thing to thinking like more broadly within the system.
Thank you both. Gemily, I'd like to perhaps put a question out there that follows up a little bit and also connects the first podcast to this one, which I think is important. This focus on education is really kind of interesting. So you're brought in here as kind of representatives of the health institution, and the first podcast rather really emphasized how education could play an important role. And then I'm struck by the fact that you're both from away and you've come here. So in the interests of public education, I'm wondering what struck you as important information to glean from this context to share impacts of climate change? What have you noticed here that perhaps you didn't notice when you were elsewhere? And it would be interesting to speak as an outsider and how you were struck by the impacts of climate change, because I think some of us may not even know how we've been impacted, and you might have insights. So could either of you share what you think might be those possibilities for learning from this particular context?
Since I'm from Ontario, which I feel is less impacted by climate change than here, I can talk about that. So I guess moving here, like I moved here after the 2021 heat dome, but I didn't really, when I was living in Ontario, I didn't really understand the severity of that event. But after moving here and taking more classes about climate change, I learned about how over 600 people died, and there were huge impacts. And then furthermore, there was like a very severe wildfire season following that, and then there were very severe floods as well in the fall, I believe. And so I think that kind of that year of climate events, like 2021, it was a series of cascading climate events where one led to the other, and it was extremely severe, and there was huge economic damages and physical damages and health damages as well. And so I think like my friends and family in Ontario, like they view me as being like on the front lines of climate change here, which I wouldn't say is true, but I would say like because BC is coastal, and just kind of the landscape with all like how there's a lot of like forests and stuff, it's more kind of like imminently impacted. But I do think Ontario is becoming more impacted as well. Like the 2023 wildfire season was unprecedented across the entire country of Canada. We don't normally have wildfires burning across like the entire country at the same time, which we did then. And that was like one of the first times that there was a lot of smoke in places like Toronto, where I used to live, and people still were going outside and doing stuff like usual, riding their bikes along the lakeshore because they didn't know about the health impacts of wildfire smoke.
Very interesting. Thank you. Nafis, what has struck you?
Yeah, actually, thank you so much, Rob, for the interesting question. Actually, when Lana was saying that, I was thinking that maybe I can share my experience here in Canada. Actually, I really didn't have much idea about the indigenous health issue in Canada, and what was historically ongoing to them, and how they are disproportionately affected by the harm of climate change. But recently, I took a course on the indigenous health where I seen that their entire food system is affected due to the impact of climate change, and they are losing their lands as well. They are losing every connection to their own land, to their culture and everything. So this really made me struck, because when someone doesn't have any connection to the land, it can impact their mental health and their entire life as well. So I think this is the most sad thing that struck me, which actually is an impact of the climate change here is ongoing in Canada. And as Canada is a developed country, and I am an international student, I really didn't have any idea about this.
Thank you very much. Just to actually connect your responses, Lana, you mentioned TAing a course in climate change. And then Nafis, you brought up a course that you took that alerted you to the disproportionate impacts on Indigenous people. So could one suggest that UBC has courses in climate change in part because they are the kind of national frontline, if you will, for climate change? And perhaps that's also a contextual aspect of being here. So that's a very nice connection that you've made. Jamali, do you have a question that you want to pose at this point?
Yeah, I don't see any questions in the chat, so I'll keep an eye out for hands risen in the audience. But I think in connection to what you were both speaking to, Lana, I think that you had maybe mentioned this, but I don't know if it was a quote or if this was you. Like I just don't remember where it was pulled from. But the conversation that ensued, I thought was really interesting. And so you mentioned that people who are impacted by climate change the most create the least impact. And I thought that that was such an impactful statement to share. And I just wonder if you could speak maybe a little bit more about that and kind of this. In my mind, I connected it to like kind of the lack of access also that some of these marginalized communities and Indigenous communities have to public health resources as well. So the resources and services and information might be limited, but we're still kind of being impacted the most while creating the least amount of climate change. And I wonder how, I mean, this is a huge question, but potentially to navigate, these historical traumas that are now ongoing and connected to climate change and like building that trusting relationship with those communities as people who work in the public health industry. And again, maybe like a disconnected question there, but yeah, I'm just curious about, your perspectives on that.
Yeah, I mean, I think as Nafis mentioned, there's huge disparities within Canada in terms of the impact of climate change and like Indigenous communities and remote and rural communities are especially like affected. And as you said, generally they have like often fewer access to resources. We know that like many first like Indigenous reserves, for example, don't have clean drinking water and they have boiling water advisory. So there's just like much fewer access to resources there. And so it's extremely unjust because Indigenous peoples have cared for and lived in harmony with this land since time immemorial. The reason that we are here on this land today is because of them in some way. So it's just very, very unjust. And then I think as well, like Nafis brings her experience living in Bangladesh, another like a lower middle income country that again contributes less to climate change and has more is facing like much more disproportionate impacts. So as far as like how to solve that problem is a very like difficult question to answer, but I think like reconciliation is extremely complicated, but it can also be as simple as starting with like building a relationship and coming from a genuine place of humility and desire to hear each other's perspectives. But again, like I'm definitely not an expert on that, but I feel like it can be very complicated, but also we could start small. Um, yeah, I'd love to hear what you think, Nafis.
Yeah, Lana, I really agree with you. Yeah, it's complicated, the reconciliation. I was just thinking maybe incorporating Indigenous leadership in the public health sector and in the sectors where climate change crisis is working is really important because the Indigenous people can share their experiences and they used to have 1,000 years of practices by which they actually preserve the environment and their lands. So for protecting their lands, their opinion and their leadership can do the best instead of any other newcomer who are living in this land. So I think Indigenous leadership is really important for addressing these problems.
Yeah, absolutely. Thank you. I completely agree. I think also uplifting Indigenous voices in terms of and learning about how Indigenous peoples relate to the land. I think that Western society could learn a lot from that. And I think also if it's okay, like this question around like who is disproportionately impacted by climate change and how that's unjust, it brought me back to another thing from the previous podcast that I learned about a lot, which was we were talking about air conditioning, and I was asking Nafis if there's like air conditioning in Bangladesh because an infrastructure difference between here and where I'm from is like here in Vancouver, fewer places have air conditioning, and that makes extreme heat a much more severe event. Whereas in Ontario, we have heat waves every year, but a lot of places have air conditioning. And I remember, Nafis, you mentioned that air conditioning is bad for the environment and makes climate change worse. And so I think like hearing you say that, although I had some awareness before, but hearing you say that made me really dig into that like more deeply. And I just like read more about this concept of climate maladaptation, which is when we try to adapt to climate change, but we end up doing things that kind of lock in existing risks and vulnerabilities. And I think air conditioning is a glaring example of that because like when I read about this more, there was this like huge survey that was done of air conditioned office buildings, and the majority of people who use those buildings found them way too cold. So it's like a huge waste where all this energy is going in to cooling these buildings for no reason. That's like actually making people uncomfortable. And meanwhile, like that huge use of energy is making climate change worse and impacting like disproportionately impacting lower middle income countries. And also air conditioning reduces like the body's physiological ability to adapt to heat. So if you're in an air conditioned space all day and then you go outside, you're going to have a harder time adapting to that heat. So it's just in so many ways a huge problem. And I just wanted to mention that because it really was something that stuck with me from the last conversation.
Yeah, Lana, I really agree with you. I think that's why we need collaboration. Interestingly, I recently saw a communication materials suggested by a health organization in Canada, where I have seen that they were suggesting when the heat wave will occur, what you will do. So they mentioned that stay inside the air conditioning home. So I was just thinking that by using that air conditioning, we are or seeing the environment, we are making the environment is more worse. So I don't think it's an effective solution. And then I was just thinking that we need more experts on the health sector who are experts on climate change problem as well. Like when as health experts we are giving a solution, maybe we are not just thinking about the climate change issues. We are making our focus, our priority just on the disease itself or the impact, but we are not focusing on the true cause or the background of that problem. So I think we need more experts on climate change issues working on the public health sector, so they can provide valuable insights for making a sustainable solution for heat waves or other global warming issues.
Yeah, absolutely. And I think like it is worth mentioning that when people get too hot, like they can die. So air conditioning is kind of the only solution that we have to heat-induced mortality. However, we really need to think about how we're distributing it and not just distribute it to the people who really need it and not distribute it in a way that is wasteful, that is locking in inequities, and that, yeah, again, requires collaboration across sectors.
Thank you both. We do have a question from the audience. I wondered if I could just do a brief follow-up first. You've opened up Pandora's box with this discussion of technological solutions, which for me is interesting from a health perspective, because if there's a justification for technology, it's generally along healthcare lines. This X will save lives. And you've, in 2 podcasts now, complicated the relationship that we have with technology. What responsibility does health as a social institution have to being a little more critical of technological innovations? Because I would say that health is at the forefront of the justification for the techno fix. And it sounds like both of you are a little less convinced of the techno fix than I would expect, given your backgrounds. So what would you say to my suggesting that healthcare, the healthcare system is at the forefront of technological innovation, and yet it may problematize the relationship we have with more basic solutions like sharing resources? But and that might be an unfair question, but it just you've done it now in a couple of podcasts, so I'm very curious.
I think for me, I think health is like I don't have the same association of health with technology, but I definitely do see what you're saying if we think about things like the acute care sector. But then when we think about the public health sector, that's more upstream and preventative. So to me, health spans all of that. And I think there is justification for technological use in the acute care sector. But I think that yeah, I just think that, sorry, I completely forgot what I was saying. If you want to jump in, do you have anything to say?
Yeah, it's really a complex thing. As public health sector works on the upstream level, in case of most of the works, I think maybe there could be some policies like while producing technological things or everything, or these two departments, tech department and public health, maybe can work together while innovating any new solutions.
Mm.
These relationships are complex. And I have seen that recently some air cooler companies have been producing eco-friendly technologies. I'm really not sure whether that works or not because I'm not an expert on that field. But maybe there could be some policy or there could be some rules by which these levels can be controlled, the production of CFC or everything. And the house could be, even the house and the urban planning system could be collaborated with the public health system. So the house could be built in a way so during the extreme heat waves, the temperature would be kept inside, so the houses can kept cold. This could be another solution. So these things are really complex. I'm not an expert, but these are my ideas.
Yes, thank you. That was probably an unfair question. Jamali, maybe I'll let you field the question from the audience.
Sure. And Kalisa, I know that you have a question as well, so maybe we'll jump to you for the live question, and then we can jump to the chat.
Okay, sounds great. Thanks. Lana, this question probably may be fielded to you first, and then Nafis, please add on to anything here. But the question is, so you had mentioned in the podcast that there's an abundance of, or perhaps even more excessive amount of clean water, food, and sanitation in some hospitals to care for newborn babies in particular. And then this may be at odds with the public health intention to enhance the sustainability of resources. So given that there is a growing movement of sustainability in healthcare, I'm wondering where you see spaces for change to balance the adequate care for mothers and newborn babies while also being mindful of sustainability efforts. Perhaps in your role specifically, but also to a more broader scale, if you can speak to this.
Yeah. I mean, I think like what I was saying in the podcast is that yeah, like the acute care sector and like my neonatal intensive care, for example, it's not one, I don't think like right now it doesn't seem like it's one of the most um like heavy emitting or like one of the sectors with the highest footprint. But I think like in general, the acute care sector has a huge impact, and my specialty is certainly a part of that. And I think something that I was thinking about that what I forgot to say in answer to the last question as well is that like we don't really have reporting of like we don't I think right now we're kind of lacking the metrics to measure the environmental impact that our acute care system has. So for example, we don't report emissions on the level of hospitals, and I think I would love to see that developed more, to see like our life cycle emissions analyses of like on the level of hospitals, but also the level of services and the level of units, and also things like the products that we're using. So that's one thing. And I think that we use so much single use like plastic, for example. So there is a lot of really exciting work that's going on right now to kind of research this more and see how we can mitigate. But like, for example, we could work on pathways with the products that we're using so that instead of being single use, they could be reused. Like maybe we could have them returned to the manufacturer and the manufacturer could recycle them, or there's other ways. Like, for example, at my work, a new thing that I'm seeing is like recycling stations for our like PPE, like our masks and things like that. And like there's been some, like they're starting to pilot that with gloves too. So basically it gets collected and then in whatever process it gets recycled. And so I think that that is a way. And then I think the other thing is kind of like um, making sure that the care that we're giving is the care that we need to give and not more and not less. So focus again on upstream prevention. I think that's a huge gap, honestly. We tend to focus most of our resources on the acute care sector, but also when we have a patient in the hospital, making sure that we're reducing like inefficiencies that would make them have the same blood test twice, for example, that they don't really need. And there's like a lot of ways that that does end up happening. Like for example, if someone has a surgery that's scheduled and then the surgery gets pushed back, they might need all this like pre-surgery diagnostics done twice because their surgery was delayed and it needs to be done within a certain time frame. So there's a lot of kind of systemic issues that we could look at to kind of make, it's called like lean care pathways, like make our care pathways more efficient. So there's a few things there.
Thanks, Lana. Nafis, did you want to add anything?
No, and Lana, thank you so much. I learned a lot from you. Basically, these things are really new for me, how the acute care system is working inside Canada. And I really agree with you. I think recycling is one of the best solutions that we can have in hospital sector because we need to give treatment to the patient. Treating the patients should be first priority, and then we have to know how to create a balance between protection of environment while treating the patient. So I think recycling is something which can be added to every sector, not only the hospital sector. And by this, we can protect the environment and mitigate the climate crisis.
Thank you both so much. And I'm just going to turn to a question in the chat here. And they say that it's great to hear that you both took some climate change related courses at UBC and that it impacted your interest and career choices. And they're wondering how you found the courses and if you feel that UBC is offering enough opportunities for students to meaningfully learn about climate change and kind of get involved with climate action on campus. And they're also wondering what UBC could do to improve this for students.
Yeah, I think there are opportunities in UBC to take courses related to climate change. But I guess like I talk about this in the first podcast, but my experience was like coming into the Master of Public Health program. I saw that one of the core curriculum themes was about climate change. And so I was really excited, but then I actually felt that climate change content wasn't that integrated into the courses that I was taking. So I ended up talking to my program director about it and then going outside of the School of Population and Public Health to take courses from other schools about climate change. And so I have looked around a lot at the courses and I think there are a lot of different courses that you can take. Especially like there's the Institute of Resources, Environment and Sustainability. So that's like one like school to check out. And then depending on your interest in what kind of angle of climate change you're interested in. Like there's the School of Geography has things, like the School of Public Policy, like zoology. So there's a lot of different kind of options. And I think that they are like growing a lot. And UBC also has like as far as I know, like they at least used to have kind of grant opportunities. So if UBC faculty want to make a course that integrates climate change content, or if they want to integrate climate change content into a course they're already teaching, they can apply for funding through the school. So I think that that's a great thing. But yeah, I think as far as like what could be done better, I think reducing the barriers for students to go from a different program and take something interdisciplinary to learn more about climate change. Like, I think that that is something that would help. And I think I think this change will happen slowly over time, but I think again, like just like in public health and health, we need to think that climate change is intersectional and it's going to kind of interact with everything. I think that in courses like climate change eventually like should not be just its own unit. It should be embedded into all of the kind of course content throughout. Like it should be an additional lens on the other things that we're talking about. So that would be nice to see, I guess.
Great. Nafis, did you want to add anything?
Yeah, I agree with Lana. I think there could be more courses at SPPH on climate change. We have some courses on environmental health, but I haven't seen any courses specifically on the climate change issue. But climate change has become an alarming issue now. So I think there could be more courses. And social equity, public health, climate change, all these things actually intersectional, as Lana was speaking. So I think it's really important to incorporate more courses at School of Population and Public Health in terms of climate change.
Great. Thank you both so much. Rob, did you have a question?
Yeah, I think, Nafis, I'd like to ask a question about health promotion from your, just from your heart. Do you think health promotion understands human actions adequately as seen in the way that it makes efforts to change behavior?
Okay, Rob, that's an interesting question. And yeah, it's a complex thing. I think sometimes health promotion can connect with what actions actually human can take, and sometimes not, because the health promotion programs depends on funds and a lot of ethical concerns as well. We have to consider a lot of ethical theories and in terms of decision making for health promotion programs. So maybe the health promotion programs sometimes align with the people's behavior, but sometimes it might not be.
Yeah, I'd love to hear, Lana, what do you think? I mean, I know that health promotion's not your, but health promotion makes its way into your world, I'm sure. What do you think, Lana?
Okay, so please, sorry, do you mind reminding me of the question? So the question is like, does health promotion recognize people's minds enough to change their behavior?
Yeah.
So I mean, I guess one thing that I learned before, I don't know if this is what the question is getting at, but I guess like one thing that I learned that I took with me was like from a behavioral psychology point of view that to really impact people's actions, we need to impact their emotions. So I'm like, I don't know if I think it would be interesting to explore more like how we are communicating like risk and health and in like public health and how effective is that? Because I think like sometimes the types of communication that people can get, it's not like something that's exciting to them, or it can feel like they're being kind of told what to do. And then it doesn't necessarily resonate with people. So I think there's ways to be more creative, I guess, with that, but it's not something that I'm an expert on. It's just something that I'm like interested in exploring more. Like, I guess that's part like I did like, so I have been working on my own podcast about climate change and health because I'm really interested in exploring more creative ways that we can communicate with people. And like the podcast that I'm working on, we're focusing more on like people telling stories about how they got into climate action, hoping that maybe it can make people feel hopeful about climate change instead of just completely turning off. And so I don't know. I mean, I wonder if there's room to do that in health communication as well. I also think when it comes to health promotion, there's the individual, but there's also like all of the structural factors that are impacting their health that need to be part of health promotion as well. We need to recognize that people don't necessarily have a full world of choices to make when it comes to their health. Sometimes their choices are limited by the social conditions in which they live. So health promotion needs to address that too.
I might be wrong, but Nafis, I think you want to say something else. Do you want to reply then to Lana? I feel like you have something to add.
Yeah, actually, I was just thinking maybe when doing any health promotion sector, health promotion policies, or doing any creating any communication material, we need to focus on the need or the language of the people, or maybe focus on the ongoing practices as well. And we need to make it somewhat culturally sensitive, so they can accept that. It's like making it more practical, realistic, and feasible for the people. The health promotion, for example, if we make a health promotion or any policy for digital technology, or using any app for the slum dwellers who doesn't have the mobile phone, or they doesn't have the proper knowledge of using a digital tech, it doesn't make sense. So I think we need to focus on these things before making any health promotion or any public health policies.
Thank you both so much. It's so rich. Thank you. Jamali, do you have a question?
I just really appreciate you bringing up like these issues of access divides as well. I think that we often overlook those things, and even in the way that we kind of share information, I feel like typically it's shared online, and there's like a cluster of issues that come with sharing kind of public health information online, but it's also those people who don't necessarily have access to that information are the ones who need it the most. So I really appreciate you shining a light on that. And I know we're getting short on time, but I just wanted to quickly ask a question about like the sharing of like misinformation and also like the trust in public health systems. I'm wondering, what you've experienced in terms of those kind of issues colliding, especially after the pandemic, or whether or not it has impacted your work or not. And if it has, how you kind of navigate those pushbacks, because obviously we don't all share the same perspective on climate change. So yeah, I'm just wondering if you've experienced any of that, and if you have, what you've done to address it.
That's a good question. It's something that I think is like extremely pertinent right now. And I wish I had the solution, or like I wish I could say like this is how I deal with this, or this is what we need to do. I mean, I think as well, like when it comes to climate change denialism, like one thing that I've realized is that there are people who I think kind of make their livelihood on spreading this misinformation. Like there's very powerful players that are in favor of like keeping the status quo and continuing like dependence on fossil fuels. And so what I do honestly is read internet comments, which is maybe healthy, maybe not healthy, but I like to see like what are people actually saying? What are people actually thinking on the other side? And then try to understand like what's the emotional kind of value that's behind what they're saying. I used to think like people who denied climate change were like ignorant, but now I think it's just like they're actually smart people who are misinformed, or they have a different perspective, or they have a different belief. So I yeah, I don't know. I want to like learn a lot more about this issue, but I think yeah, I like to just kind of intellectualize it and understand what is the value behind what people are saying, and also recognize that there's money going into peddling climate misinformation. So it's a big, big thing.
Thanks, Lana. No, that was great. And Nafis, do you have anything to add to that?
Yeah, when Lana was saying that the climate change issues is neglected by some people, I was just thinking that yeah, climate change has become a global issue, but I think it's related to geopolitics as well. So in some countries, climate change problem is denied, it's not focused. And I have seen in some sectors, even in public health sector, I have seen that the climate change related projects or the programs doesn't get the fund, because sometimes the donor organization may think that it's not a major issue, so they prioritize other things. So I think this transmitting misinformation related to climate change has really affected the public health sector. Even in Bangladesh, recently climate change has become a hot topic, but I have seen that previously I have seen that there were no activities related to climate change. But when in the coastal areas, the salinity of water is increasing, and several papers have been published how hypertension is being increased in the vulnerable communities in climate change due to the increased salinity in those areas, and the frequent flooding in the coastal areas of Bangladesh. Because of this, the children cannot go to school. When all these things are happening now, the funds for climate change program has become a thing for to get prioritized. So I think due to this misinformation, climate change and its impact were always present in Bangladesh, or even in Canada as well. But due to these diplomatic things like geopolitics and the fossil fuel producers or the large big companies who sells fossil fuels, I think the climate change issues is somehow it's hidden. Somehow it's neglected now.
Thank you both so much. It looks like we're at 1 o'clock on the dot. I just want to thank you both so much for sharing your perspectives with us. You've taught me so much, and also to thank everyone who's joined us today and who shared their incredible questions. Rob, is there anything you want to say quickly before?
Yeah, Nafis and Lana, if you need anything from myself along the lines of collaboration, I'd be really excited to talk with you again. And I probably can say the same on behalf of LDDI.
Absolutely.
It's just great to listen to you speak. And I was going to say, we threw some hard questions at you today. We didn't strategize to do that, to be honest, but you just seem to have such capacity. So thank you very much. It was very rich.
Yeah, we've learned so much from you today. And before we let everyone go, we'd just like to invite you to complete a brief survey about today's session. If you enjoyed today's session, you can join our upcoming Viewpoint session. So we've got a few more Viewpoint sessions coming up. So one next month, that'll be, I believe, May 17th. So please join us for that. And if you have any questions for LDDI, you can contact us on Twitter or email, or you can visit our website. So thanks again, everyone, for joining us. And thank you, Lana and Nafis, as well, for sharing your wisdom with us. We've learned so much from you. And Lana, if you want to share your podcast with us whenever it's up and running, please do. Unless it is up and running and you want to share the link, we're happy to include it on our website. But thank you both so much for joining us.
Thank you so much. I will let you know when it's launching. Thank you for this. It was a great opportunity.
Thank you so much, Yamili. Thank you so much, Rob. Thank you.
Thank you.